Now this video we're looking at what to expect following an Achilles rupture repair, but first, our disclaimer. Dr. Mike Matthews, physical therapist here with the PT411. Thanks so much for joining me. If you already haven't done so, make sure you follow, like, subscribe, Facebook, YouTube, Instagram, TikTok, and Twitter. Also, make sure you check out thept411.com. So, another WTE video, what to expect following an Achilles tendon repair surgery. And I will say before I start this video, anytime you are having surgery, please do not go online and find a video of the surgery being performed beforehand. At least wait until after you have the surgery if you're curious. Now on to the Achilles tendon repair. First off, you will not be putting weight through that foot early on. You'll be placed on crutches and either casted or be placed in a boot to immobilize the ankle. We don't want any stretch or work out of the calf muscle nor the tendon that they pull on. The non-weight bearing status can differ from surgeon to surgeon and also depends on the extent of the injury and the surgery itself. Now the earliest I've ever seen starting to put weight through it is at about 3 weeks. That's pretty early, sometimes as long as 6 weeks. Most commonly, it's at about 4 weeks that we start putting weight on it. While we're not putting weight through it, we're still going through therapy. We're still working on other things. Some things include inflammation control, your medications, ice, elevation, and we also need to keep the rest of the leg strong and mobile so that when it's actually time to start walking on it, we're not having to worry about stiffness or weakness at the knee or at the hip or anything else related to the leg. Around the time it's time to start putting weight through it, we're also going to start working on ankle mobility to most directions. We're still going to avoid putting too much stretch on the tendon, so we're not going to force it into dorsiflexion much, but our medial lateral movements as well as plantar flexion are still a pretty good go at this point. Get those back as quickly as we can. Now the walking boot during this time usually will have a wedge under the heel that prevents too much dorsiflexion, but over time the wedges are changed out to smaller ones to allow for a very slow progression into more stretch on that tendon. We're going to start by partially weight bearing through that foot. This is going to vary from person to person, but usually starts off at around 25% of our body weight. Each week or so, the surgeon will allow about 25% more until we get to 100% weight bearing. And typically we want to try to time this out that no more wedges are in the boot at about the same time that we are starting to get more closer to 100% weight bearing. Around this time, we're usually only about 7 to 8 weeks out and we're still in the boot for our walking, but we're going to get out of it for physical therapy and exercises, well, most of them at least. Exercising is going to include a stationary bike, aquatic therapy, ankle strengthening with a band, simple balancing exercises, and hands-on therapy from the PT is going to get much more aggressive. We also start getting more aggressive with our calf stretches, just slowly. Now around week 9, we start working more advanced exercises, getting into our squats, our partial lunges, heel raises, and we'll also progress our balancing exercises to make those much more difficult as well using various equipment. We also want to work into getting more dorsiflexion mobility at around week 10. Once we get full mobility, we can start doing bigger calf raises, progressing those off of a step. Now, depending on the individual's activity level, we may be even getting off the rehab train sooner or later. Some people living a less active lifestyle may be stopping earlier, while an athlete will go much longer. Once we're at about 12 weeks or 3 months out, we'll start progressing as quickly as the body will allow us to. We're going to listen to our abilities and our symptoms, but we need to continuously challenge that lower extremity. This continues through about month 5, then we start working on running programs. At about 6 months, we can start picking up agility, plyometrics, our jumping activities. Now, most athletes will return to their sports at around 7 or 8 months after surgery. Just make sure that you're following all of your surgeon's instructions, listen to your PT as well, and stay on top of your homework, those home exercises. You're in full control of your recovery. Again, this is the PT411 and I'm Dr. Mike Matthews, physical therapist. Thanks for joining me.